Next time, lymphatic outflow from abdominal cavity, pelvis, and lower extremity. Small intestine, pancreas, liver, stomach, external genital, rectum, urinary bladder, and lower extremity, yes. Well, hold this topic from 333 page till 342. It is not so difficult, but necessary to understand main things in this moment. Look here. For example, I explain only 3 organs today. Look here, that is lower extremity. Do you remember which vein, superficial vein, start from middle side of the foot? Vena saphena magna. And vena saphena magna goes to femoral vein below of inguinal ligament, yes, through hiatus saphenous, do you remember? And on lateral side we have vena saphena parva, and it goes into popliteal vein. And now lymphatic outflow from lower extremity. The same here it is, we have superficial and deep lymphatic vessels, and superficial lymphatic vessels pass together with superficial veins. That is why from first, second and third toes on the foot, from middle side of the foot, from middle side of the leg, lymph flow to superficial inguinal lymph nodes. That is first regional lymph node from middle side. And from superficial inguinal lymph nodes, lymph flow to deep inguinal lymph nodes. And from deep inguinal continues into external iliac. Is it clear? Then, from lateral side, lymph goes to popliteal lymph nodes. And from popliteal, directly into deep inguinal. And from all deep structures, from muscles, from tendons, ligaments, capsules of joints, from all deep structures, lymph also goes to popliteal lymph nodes, the same like from lateral side. That is why one way directly into superficial inguinal, another superficial way into popliteal, and from all deep structures the same into popliteal. From popliteal into deep inguinal, and then all another goes to external iliac. From external iliac goes to internal iliac. Internal iliac goes to nodi lymphatici lumbalis, and nodi lymphatici lumbalis goes to truncus lumbalis, then ductus thoracicus, and then left venous angle. That is all. If we speak about lymphatic outflow from rectum, from external, from canalis analis, from anus, lymph goes to superficial inguinal lymph nodes. That is necessary to remember. That is new information for you. Goes to superficial inguinal. And from superficial inguinal goes to deep inguinal, external iliac, common iliac, lumbar, and so on. The same from penis, from scrotum, from skin of the penis, scrotum, labia pudendi majora. The same lymph flows to superficial inguinal lymph nodes, then deep inguinal, and so on. From middle part of rectum, lymph flow into nodi lymphatici iliaci interni and nodi lymphatici sacralis. Then goes to nodi lymphatici iliaci communis, nodi lymphatici lumbalis, truncus lumbalis, ductus thoracicus, and left venous angle. Clear it is? And from upper part of rectum, lymph flow to nodi lymphatici mesenterici inferior, and then one way into truncus intestinalis and goes to ductus truncus lumbalis and ductus thoracicus, or if intestinal trunk is absent, in this case nodi lymphatici lumbalis, truncus lumbalis, ductus thoracicus, and left venous angle. Clear it is? If we speak about stomach, here it is 4 places. First, that is cardiac part of stomach, then a fundus and part of greater cavity of the stomach, next another part of greater cavity, and last, that is pyloric part and lesser cavity. From first region, lymph flow into nodi lymphatici parasternalis in thoracic cage, goes upward, pass through diaphragm, and goes to nodi lymphatici parasternalis and retrosternalis in anterior mediastinum. Then truncus broncha mediastinalis, and then on the right side ductus lymphaticus dexter, on the left side ductus thoracicus, and then right or left venous angle. Only from here, from cardiac part. From a fundus and part of greater cavity, lymph flow to nodi lymphatici lienalis, near of spleen, nodi lymphatici lienalis, then truncus lumbalis, ductus thoracicus, and left venous angle. Greater cavity of the stomach, nodi lymphatici gastroepiploici. Do you remember here it is arteria gastroepiploica dextra, here it is gastroepiploica sinistra. That is why regional lymph node here it is nodi lymphatici gastroepiploici. From here it is nodi lymphatici mesenterici superior, and then truncus lumbalis, ductus thoracicus, and left venous angle. And last, from pyloric part and lesser cavity, here it is nodi lymphatici hepatici, nodi lymphatici celiaci, and nodi lymphatici pylorici. 3 groups of lymph nodes: pyloric, hepatic, and celiac. And from all of them continues into truncus lumbalis, then ductus thoracicus, and left venous angle. Clear it is? And in your manual, everything is described with arrows from which lymph nodes continues to another, and then continues to another, and then goes to ductus thoracicus, in most cases ductus thoracicus and left venous angle from abdominal cavity. Next classes, you will answer head, neck, thoracic cage, and upper extremity next time. Today, abdominal cavity and everything what is below. And in time of our last classes, I give you 2 inner organs, I think 2 diagrams, and 2 inner organs, and you will describe lymphatic drainage. Clear it is? And next time the same, I give you written test, and you will write how lymph flow from liver, from stomach, from pancreas, from lower extremity, uterus, rectum, and so on. Any questions? You not need to draw, just you will write with arrows from which organ continues to left venous angle. Well, any questions? Today that is upper extremity. The same like lower extremity, here it is we have superficial and deep lymphatic vessels. Superficial vessels pass together with superficial veins. In radial side, what is a vein? Who remember? Cephalic vein. And on other side, basilic vein. That is why from first and second fingers, from first and second, lymph flow along of cephalic vein and goes to superficial axillary lymph nodes. From superficial axillary, help me? Deep axillary. From deep axillary, subclavian trunk. Truncus subclavius. And truncus subclavius on the right side goes to right venous angle, right lymphatic duct and right venous angle. On the left side, thoracic duct and left venous angle. Then superficial lymphatic vessels from third, fourth, fifth fingers together with basilic vein goes to cubital lymph nodes. Nodi lymphatic cubitalis, cubital lymph nodes. And from here into deep axillary, and then truncus subclavius and so on. And from all deep structures, lymph also goes to cubital and then deep axillary. It is not so difficult if you already know lower extremity, yes? Mammary gland. We subdivide mammary gland into 4 regions. Lateral upper and lower, lateral half of mammary gland. Lymph flow to superficial axillary lymph nodes. Then deep axillary, truncus subclavius, ductus thoracicus or ductus lymphaticus dexter, right or left venous angle. From upper middle part, from here lymph goes to supra and infraclavicular lymph nodes, and from here goes to jugular trunk, truncus jugularis, and jugular trunk continues into right lymphatic duct or thoracic duct. Clear? And last, from lower middle part, lymph goes to parasternal and retrosternal lymph nodes. And then you already know truncus bronchomediastinalis, ductus thoracicus or ductus lymphaticus dexter. Skin of the head. From occipital region, lymph goes to occipital and retroauricular lymph nodes. From upper lip and skin above of the upper lip, facial region above of upper lip, lymph goes to superficial parotid lymph nodes. And from lower lip, from skin of the mandible, lymph goes to nodi lymphaticus submentalis and nodi lymphaticus submandibularis. And from all of these lymph nodes, lymph goes to jugular trunk, truncus jugularis, then ductus thoracicus or ductus lymphaticus dexter, and so on. You need to prepare heart, lungs, esophagus, what else? Thyroid gland, eyeball, organs of orbiter, that is lacrimal gland. In eyeball we have not got in cornea and in lens, but in sclera we have lymph nodes in sclera of eye. You remember that inside of skull, in brain and meninges of brain, lymphatic vessels are absent, yes. Well, you need to answer on Wednesday: head, neck, thoracic cage, and upper extremity. Clear?
And Wednesday's the last.
The same like today, I give you written test, and next Monday you will have written test in venous and lymphatic system, and on Wednesday